come in.
Tamaya?
Yes.
Hi, I'm Carolyn. I'll be your nurse today. How are you?
Good, how are you?
Good. Let me just wash up my hands and put my gloves on. Okay. Can you give me your full name and date of birth, please?
Tamaya Johnson, January 2nd, 2002.
Okay, let me see your wristband.
Mm-hmm.
Okay, great. All right. And what brings you here today?
Oh, I was having some pain in my ankle.
Okay. On a scale of 0 to 10, with 10 being the worst pain, what would you say your pain is?
About a 2.
Okay, got it. So what I want to do first, I want to do a full assessment on you. I want to just, if you can kind of scoot up and then kind of swing your legs off on the, dangle them off the bed, yeah, like that.
Okay.
And I want to just do a full assessment. So I'm going to start with your hair. Do you mind me touching your hair?
No, I don't mind.
Okay, got it. Okay, so your scalp is free of any lesions. I don't see any lesions or bumps in your scalp, and it looks nice and clean. All right. What I want to do now is just kind of do like a eye assessment.
Mm-hmm.
Okay. I want you to just look straight at me, and I'm going to shine this light on your eye, on your pupil. Okay. Your pupil does react to the light. Okay. Both pupils are bilateral and equal. Okay. Your face is symmetrical. Your nose is symmetrical to your face. Let me take a look in your ear. Okay, I don't see any drainage or excessive earwax. Let's check the other one. Okay, that one looks the same, no drainage. Open your mouth and take a look in your mouth. Okay, your mucosa looks clear and red and moist. Do you have any missing teeth?
No.
Okay, I didn't see any. Okay. Hold up, let me see your nose. Okay. No drainage, okay, or mucus. Okay. All right, so what I want to do now is I'm going to whisper something, and I want you to tell me if you can hear me.
Okay.
My dog is a pit bull.
My dog is a pit bull?
Yes. Okay, we'll go on this side. My dog is a pit bull.
My dog is a pit bull.
Okay. All right. Hearing seems to be intact. Let me ask you a couple of questions. So you did tell me your name. Can you tell me who is the president?
Donald Trump.
Okay. And do you know where you are right now?
Yes.
Okay. So it seems that you do have full consciousness, and you are oriented to person, place, and time. Actually, what year is it?
2025.
Okay, great. So you are oriented to person, place, and time. Okay. On a Glasgow scale, coma scale, I rate that you are a 15, and that is the best possible. That means you are oriented, you obey commands, and your eyes open spontaneously. Okay, what I want to do now is just do a couple range of motion exercises. I need you to just like raise your arms up and kind of like lift them up and down.
Okay.
If you want to stand up,
You want me to stand?
Stand up if you want to.
Okay.
And I just want to see your range of motion. Okay, and then do them like this. Okay, got it. All right, and then I want you to sit back on the bed, and I want to see you do your legs the same way. Just kind of extend them and then bring them back. And I want to kind of like put a little resistance to it. Okay, so I'm going to do the other side. Okay, and then do it that way. Bring it this way. And that one this way. Okay, great. Let me do the same thing to your arm, like flex. I want you to flex. Okay. And then I'm going to put some resistance. Okay, and then this way. Okay. Other one. Flex. Okay, this way. Okay, great. Alright, so you seem to have a good range of motion. What I want to do now is a respiratory. I want to listen to your lung sounds. Okay, so if you wanna just lay flat on the bed for me, I just move the pillows over. Do me a favor, sit up and sit up. Dangle your legs off the bed. And then you kind of bend over, like put your hands, so I can carry it back. Your posterior lung sounds. Okay, lung sound sounds clear. No, I don't hear any type of mucus or anything in your lungs. Okay, now I want to listen to your cardiac sounds. Alright, cardiac sounds are clear. What I would like to do now is have you walk for me. I want you to, I want to see your gait. I want to see how you just kind of like put one foot in front of the other like that and kind of walk to that way, to the wall and come back. Alright, stop, come back. Okay. Alright, if you can sit back on the bed now. I want to do a skin assessment. Okay. So what I want to do is kind of just touch your skin, and then I also want to just take a look at your capillary refills. So they are less than 2 seconds. When I touch on them, the color comes back in less than 2 seconds. Okay. Let me see the other one. Same thing. Okay. All right. I'm going to feel you. I want to see if you're warm and moist, or if you have any type of edema. Okay. Okay. No edema noted in the upper limbs. Let me try your legs. And let me feel you get your pulse. Okay, your pedis pulse is bounding and strong. Okay. Same here, bilateral pedis pulse bounding and strong. Okay, what I would like to do now, do you have any history of GI problems?
No.
Okay. How often do you go to the bathroom? How often do you defecate?
Daily.
Okay. And so you have a pretty good diet? Okay. And how often do you urinate?
Daily.
Okay. Do you have any history of urinary incontinence?
No.
Okay. Alright, so what I want you to do now is just lay on the bed. I'm going to do an assessment on your bowel sounds. Okay, bowel sounds are active. No extra you know, extra active sounds, but just normal active sounds. Also, I wanted to note that your apical pulse was taken prior, and I held it for a full 60 seconds, and the apical pulse was normal in range. Now, do you have any history of falls?
No, I do.
Now, other than just your ankle a year ago, right?
No, that was it.
Okay. Do you have any other mobility issues, or do you have any walking devices that you use?
No.
Currently? Okay. So you can ambulate well and independent on your own, correct?
Yes.
Okay. Alrighty. Well, it sounds like I'm done with my assessment. What I would like to do now is just make sure that there are no cords or anything in the way, so if you have to get up, you won't trip. So I'm just gonna kind of move this out of the way. Okay, and I'm gonna make sure your call light is close to you and your bottle of water here on your nightstand.
Thank you.
Okay, your doctor will be in to see you.
Okay.
All right, bye-bye.